Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, as the country races to acquire COVID-19 vaccines, senators question government's deal with Sinovac, a vaccine provider from China. Despite the confidentiality agreement, Malacanang insists Sinovac vaccines cost only around 650 pesos per dose. So, how safe is the Sinovac vaccine and why should Filipinos consider getting it? Sinovac Biotech General Manager Helen Yang joins us live. Malacanang is standing firm on its decision to purchase Sinovac vaccines despite concerns on its pricing and efficacy. Although the actual price could not be disclosed, presidential spokesperson Harry Roque said that the cost of Sinovac vaccines being purchased by the government is not far from other countries. Meanwhile, vaccine czar Carlito Galvez says government may still call off its procurement deal with China's Sinovac. In a Senate hearing, Galvez clarified that the deal is not yet final and they can still opt out since the Sinovac vaccine has yet to receive regulatory approval. Government earlier announced that it secured 25 million doses of COVID-19 vaccines from Sinovac. Let's go straight to the source of the story. We have Sinovac Biotech General Manager Helen Yang. Ms. Yang, welcome to the source. Thank you so much for your time.
Thank you. Thank you for having me.
Let's start with this. What is the latest on the Philippine vaccine deal with Sinovac?
Yeah, we actually engaged in discussion with the Philippine government of potentially providing 25 million doses. We have already entered into a term sheet with the Philippine government, and if it is approved, and we should discuss further on the definitive agreement. That is where we are, and we're also in parallel preparing the registration documents. Some of them already been submitted to the regulators, and we're still working on that.
You said that you have finalized, did you say term sheet?
Yeah, I did. It's a term sheet.
What exactly is a term sheet so we can understand it better?
Sure. Normally, term sheet is a non-binding understanding between the buyers and sellers on some of the terms that they most cares about. And if in the general terms is acceptable to both, and then both parties should develop a binding definitive agreement. That's normally on a commercial deal we would normally do.
I see.
Similar to other deals.
Would you characterize it that we are in the middle stage of the negotiations with Sinovac, the Philippine government?
Yeah, if you put it in that way.
Okay. And when does it actually become binding? What are the factors that must be put in place so that the agreement is finalized?
Sure. Actually, a definitive agreement will include a lot more terms, including how to deal with side effects, logistics, what is the final acceptance, what is the quality testing standards, and if adverse reaction happens, how we're going to do, sort of things. The term sheet is a lot simpler.
I see. It's as if there needs to be a lot more input that should be part of the final deal. So let's clarify, it's not yet, the deal is not yet sealed.
No.
No. So Sinovac is supposed to we're expecting, rather, let me repeat that. We're supposed to be expecting about 50,000 doses in February. So if the deal is still not sealed, is Sinovac still going to supply the Philippine government 50,000 vaccines come February?
I think the purpose of Sinovac's activity is trying to help. And we will actively discussing with the Philippine government. I understand this is a pandemic situation, but of course, before any vaccine can be used, it has to be approved by the local regulator. And if there is an urgent need, even before definitive agreement is agreed and is accepted and required by the Philippine government, I think we will try our best to be flexible. But if it is choose to be signing the definitive agreement before any delivery of the products, I think that would be totally fine from Sinovac side. We're just trying to be helpful.
Okay. Did the term sheet also include the 50,000 doses in February, 950,000 doses in March, 1 million in April, and so on and so forth?
Actually, that was for 25 million doses because the actual delivery is a matter of how to execute the collaboration. So that's why we can discuss in detail and see how we can manage that practically.
Mm-hmm.
But we're all included.
But Ms. Yang, where did the 50,000 in February, 950,000 in March, 1 million in April come from? Because if in fact that is to be fulfilled, Sinovac rather will be the first vaccine to make it to our shores, to Philippine shores.
Right. Actually, Sinovac already started producing the vaccine in the large commercial size in late last year because we understand the pandemic required the immediate delivery of the products in order to prevent the epidemic as soon as we can. So we are continuously producing. Yes. It's just a matter of where we're shaping it.
Okay, but is Sinovac still going to provide 50,000 vaccines in February?
We can if it is required.
But it's not in the term sheet.
It is in the quantity is included in the term sheet. And normally we do is that we have a tentative supply schedule agreed by both, and we will work on that objective and try to make it happen.
I see.
If it is finally confirmed.
So it's part of the supply agreement that in February we will get 50,000 doses of Sinovac.
Yeah, that's our understanding.
Okay. And do you know exactly when? Because obviously, as you mentioned a while ago, this would also depend if the FDA approves the EUA of Sinovac.
Right. So that's why it is hard for me to give an exact timing because there are so many different factors impact the timing. But I believe everyone's are trying to save lives right now. So if we can do it sooner, it won't be later.
Mm-hmm. So it all obviously is dependent on the approval of the EUA of the FDA. So still, the agreement would be, maybe it's best to confirm with you, 25 million by the end of 2021, indeed, if it is approved.
You're right.
Okay. Let's talk about price. Ms. Yang, so how much is it? Because Secretary, there's so much talk about really how much Sinovac will be costing the Philippines. Some were saying it was one of the more expensive ones. Secretary Roque last week said, no, it's not the most expensive or second. It's actually mid-range. And then very recently, yesterday, during an interview on DZBB, he said that more or less it's about 650 pesos per dose. Can you confirm this?
Well, in terms of pricing, definitely we're not on the highest expensive ones because I think it is the mission for Sinovac to provide the vaccine at an affordable price. And actually, it's a lot lower than the what being quoted in the past from Philippines. But however, the pricing is not only one factor. I think it's more like people should think about what are the costs being involved of using the vaccine. Buying vaccine is only one factor. Logistics, transportations, and infrastructure of getting the vaccine rolled out in the country should be included. And also, I believe that this is also needs to be compared about the life saving and how much reduce on the burden from the society. And in terms of Sinovac, I think for us, different countries having a different situation, and the presentations, delivery schedules, other terms, regulatory complexities, all matters of a pricing. But for Philippines, we do committed to provide a favorable price. But unfortunately, I'm not in a position to discuss this confidential information at this moment. But I will be assuring you that this is a very good price that we provided to Philippines.
But I understand there's a non-closure, there's a confidentiality here on the disclosure agreement, but it is already the presidential spokesperson who said that it's about 650 pesos. Also, let's look at Indonesia, wherein it was reported that a dose of Sinovac would cost about 200,000 rupiah, which is more or less, again, about 650 or 680 pesos. Would you just say that that would be somehow be the price range?
I'm not going to comment on that. I'm sorry.
But is it sold in Indonesia for 200,000 rupiah? Was it bought for 200,000 rupiah?
Again, the other deals is also protected by the confidential agreement between us and our partners. I'm not going to comment on that pricing either.
Okay, so you don't want to comment on the 650 pesos. That's okay, but you're saying that it's not the most expensive. You are confirming that it's not the most or the second most expensive.
That's not the second most expensive, I can assure you.
Can I ask again? I'd like to do a follow-up. Would you say it's mid-range, the pricing?
It is reasonable, I believe.
Reasonable. All right. So let's talk about the trials because phase 1 and phase 2 clinical trials have been completed. Can you tell us, give us any information on how the clinical phase 3 trials are going?
Sure. Actually, we are conducting phase 3 trial in 4 different countries. We started in July in Brazil and then August in Indonesia, as well as in September in Turkey. Turkey is the first one to announce the preliminary results. We call it interim analysis, showing that the vaccine protective rate is about 91.25%. And after that, Brazil made the announcement of a more detailed analysis about the results. It shows that the 100% protection against the severe and hospitalized cases, and also 78% against those mild cases, but with medical assistance, also a burden to healthcare system. But if we include everyone, even those very mild, without any intervention from the medical facilities, the efficacy rate is about 50%. And we're very happy to see that just last night, while we're sleeping, we got the approval from Brazil of using the CoronaVac under emergency use in Brazil.
So you got that already in Brazil, because that's the bone of contention that even senators are wondering about. Brazil came up with the efficacy of about 50%, and you have Turkey coming up with the efficacy rate of about, as you mentioned, 91.5. There came, a little doubt on how safe, or how, it's not really how safe, how effective Sinovac is. So I think it's good for you, again, Ms. Yang, to repeat that 51% is what, an average of what? It's 100% effective for the severe, it's 78% effective for the mild, and what, the 50% effective on the very mild cases? Is that what you meant by that?
Well, the 50% is to include every cases we confirm, including the severe, including the hospitalized, including the mild, with or without medical assistance. Because in these 250 cases identified in Brazil trial, 85% of them are very mild symptoms without any requirement for medical assistance. So if we include them together, the average rate, the overall efficacy rate in Brazil trial is 50%, slightly above 50%. But that still meet the standard from WHO.
Right.
And this trial is only for healthcare workers. Those are very high risk group exposed to the viruses. So even in this very challenging environment, the result is still meet the WHO standards. We think this is fantastic results.
Why would it be, I'm not sure if you can help us understand this, but why would it be less effective for why would it be more effective for those severe cases and less effective for those milder cases?
Oh, we don't normally say whether it's higher effective or less effective, because for the severe cases, we can clearly see that none of the severe cases arise from the vaccine group. All of them are coming from the placebo, i.e. those who didn't receive the vaccine. And that means the vaccine can protect the people from severe cases 100%. But for the 50%, it is including all the healthcare workers that showing the PCR positive. This is a very high sensitive testing. But for those healthcare workers, they're working in the environment with a higher chance of contacting the viruses. So even some of them may show some very mild symptoms, not specific to COVID, but they can contact the virus and they can be the virus carrier. Therefore, that there might be some bias or issues of collecting those cases. But we want to see an overall numbers of efficacy, even if including those very mild symptoms. And that gives the number of 51. This is not the general population. We think that if the test is being done like in Turkey, for general populations, we think the number should go up or being higher than these 50%.
Hence, the numbers in Turkey for you are more accurate, would you say that, than the one in Brazil?
We think that is, well, even though it is very difficult to compare trial to trial because the volunteers and timelines and practices are different. But within for Turkey, the volunteers are most of the volunteers are general population, and that's more representative if we use it to the general population, if we put it in that way.
We'll be taking a short break. This is The Source on CNN Philippines. Please stay tuned. Watching The Source on CNN Philippines, our guest today is Sinovac Biotech General Manager Helen Yang. Let's go back to what we talked about prior to the break, Ms. Yang. So in Brazil, 51%, in Turkey, 91.25%. And very recently, well, it was last week, I believe, that the Indonesian president was vaccinated with Sinovac. And also last week, the health minister of Turkey and the President Erdogan, also vaccinated by Sinovac. Have there been any concerns so far or any feedback on possible side effects of Sinovac?
Actually, when talking about the safety aspect of our vaccine, we believe that's one of the a strong advantage because the technology we use is inactivated vaccine. And inactivation is a technology has been applied for so many years. It has been used in decades of developing vaccines and used a big amount in human beings. So the safety profile is shown to be very good, not only from the COVID vaccine, but also from our other vaccines using the same technology. So from the phase 1, phase 2, and even in large-scale phase 3, our safety data collected showing there is no serious adverse reactions related to vaccine, and also the most of the reported side effect is the pain at injection site, which is reasonable,
right.
And we don't have a high fever. So the safety profile for the vaccine is very, very good.
So you said no serious adverse reaction so far, but anything on the less serious aside from the fever that you had mentioned a while ago? Right.
The adverse events for using vaccines can arise, but we need to compare about how severe of that reaction would be. Like the vaccine, if you would have a pain, or if you feel, if you got some fevers, you need to see how long it goes away and what is the highest temperature. I think for Sinovac's CoronaVac, our safety profile is very good. The pain is only, as reported by our partner from other countries where they're doing phase 3, only around 20% of people reported pain at injection site. And the fever rate is, I think that is the highest number of reported side effects. And the others are all common side effects as other vaccines. We have already published that for phase 1 and phase 2 on the Lancet, and we welcome the readers to review that.
Yeah. So when is the clinical trial for the phase 3? When will that be out?
Well, actually, for Brazil trial, the actual field work already been completed and the analysis already been submitted to Anvisa. Turkey trial is still ongoing after they announced the interim. Indonesia completed, and Chile is still ongoing without any announcement of the result because they just recently started.
And when will we be able to, or at least experts, look into or filter and analyze what is part of, or what is part rather of the phase 3 clinical trial. When will it be available for perusal?
Right. Actually, because we conduct a trial on each single different countries and they're independent trial, currently just last night, I think the Brazilian FDA already made the evaluation and there are sources publicly available. Okay. And for Turkey trial is still ongoing. I believe after it's done, it will go publication sometime, and we need to discuss with our partners when it's done. But for Sinovac, we are going to collect all these 4 trials data back to China, analyze it based on the Chinese FDA's requirement, and make the filing in China.
And so far, I believe the mass vaccination has begun in Indonesia and also in Turkey.
Right.
Any other countries?
Actually, in June, China already approved to use CoronaVac for emergency use. And up till now, we have already delivered several million doses for China. And just last night, soon after the announcement of EUA approval in Brazil, the vaccination already been started. I just learned already over 100 people got vaccinated with CoronaVac under emergency use in Brazil.
Right. So it was under emergency use in China. Would you be able to tell us how many have been vaccinated in China with Sinovac?
I only have the number of doses that we ship out. How many people got vaccinated is we don't have that number. But I believe there will be a lot of people used for that vaccine already.
Could you repeat how many vaccines have been rolled out of Sinovac in China?
Right. We have provided over 8 million doses of our vaccine to China.
I see. Again, we need to take a very short break. The Source will be right back. You're watching The Source on CNN Philippines. Our guest today is Sinovac Biotech General Manager Helen Yang. Ms. Yang, so Sinovac already applied for emergency use authorization in the Philippines. Do you have any idea, or when are you expecting a possible, positive result from the EUA application?
Actually, we are working days and nights to compile all of the required documents and make the submission along with our local partners. But I think this is in the hand of a regulator, and if they require additional documents, we will try our best to supply. I believe that everyone worked very hard trying to get the country to have an access to this very safe and effective vaccine as soon as we can.
So, will the deal be finalized after the approval of the EUA, or can the deal be finalized and then thereafter the EUA could get approval? Because I'm surmising that Sinovac is confident that you will get an EUA.
Actually, that is the decision made by the Philippine FDA. Of course, we will try our best to satisfy their need. But which one goes first, I think we will be flexible and see how practically that works for the country.
Right. But it needs to, I guess the point I'm trying to drive at is it kind of needs to happen fast if we're still expecting 50,000 doses to arrive by February.
Yeah, I agree with you. We need to move very fast. So I think the most of the documents already been submitted. And we're actively discussing and reporting to FDA whenever they have any questions.
State Councilor Wang Yi was also here very recently, and he said that China will be donating 500,000 doses of vaccine to the country. Would a part of this be coming from Sinovac?
I think that's separate as far as I understood, because in China, this is not only one company developing and supplying this vaccine.
Right.
But that shows, I think, for China is a different aspect are trying to help.
Understandably, but has there been talk that some donation will actually be coming from Sinovac, a part of the 500,000 donation coming from China?
Okay, because I think that for the donation is more arranged by the government, the source of the supply. We are discussing with the government, but I don't know how much it would be allocated to this one. But no matter what is needed, we want to be supportive.
Okay. Let's talk about also, I'm sure you've been watching the news or reading about it, the kind of trust. Well, first of all, almost half of Filipinos are hesitant to get vaccinated. And then when this news came out that it's 50% efficacy in Brazil, but 91% in Turkey, there were there was some possibly more apprehension to be vaccinated with the Sinovac. Of course, the news is big because it's supposed to be the first vaccine that the Philippines will have. How would you possibly respond to trust issues with the Sinovac vaccine?
I think using of the vaccines is more like to lower down the burden of society and healthcare system. If we short of beds and short of healthcare workers, doctors, and nurses, that will be a disaster. So that's why I was trying to explain for the Brazil trials, the overall efficacy rate 50%, including very, very mild symptoms, which if people get a cold, you may not even to go to the hospital, right? But I think the severe cases and hospitalized cases, and even those mild, need to have a medical assistance, are having a pretty high efficacy rate. That is what we should focus on.
And that is what you want those who may be hesitant to be inoculated with this vaccine to remember. Is that what you're saying?
Yeah, that's a results we would like to see after using the vaccine. Then the society can be back to normal. Mm-hmm. You know, we have sufficient healthcare workers to maintain the treatments of our patients, and they don't got crashed. I think that it's very important to give the confidence to the society, to the country, and also to give a confidence of the possibility that economic activities can be returned to normal.
All right. Thank you to Sinovac Biotech General Manager Helen Yang.
Yeah, thank you.
Thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.